Thank you, Caroline. I'm Kat Capstick, and here with me today on our panel are three of our regular political experts. Quentin T. Howell, chairman of the Baldwin County Democratic Party, Jahan El-Jabaghi, assistant professor of business law here at Georgia College, and Dr. Harold Mock, an assistant professor of history and director of the Georgia College Leadership Program. Welcome back to all of you. We're thrilled to have you.
Thank you very much.
So obviously a big question on everyone's mind and an issue that has risen in prominence in the past few weeks is the coronavirus. We're seeing an increase in cases not only worldwide but here in the United States as well as here in Georgia. So we've seen that it's not only impacting the stock market, which is having a historic crash, but that it's impacting American politicians. It's been confirmed that members of Congress who attended a CPAC conference came into contact with someone who has been confirmed as having the coronavirus. And the concern is that some of those members of Congress have interacted with Donald Trump. Now, some of them are self-quarantining, but some are not. The question remains, how can this affect our halls of Congress? I'd like to turn this over to you, Dr. Mock. If the coronavirus and the exposure to it continues to spread among politicians, how do you think it's going to affect our lawmakers?
Well, I don't know. That's a broad question. Certainly, we don't have a lot of precedent for this in the American political system. What I think concerns me the most is that we've entered an age, I suppose, in the past few years in which we have consistently degraded the role that expertise plays in American politics, and we have become, I think, far more reliant on maybe histrionics and public pronouncements than what we should be listening for, which is sober, reasoned guidance from trained experts.
That's, I think, a very valid concern, especially in the age of social media with the proliferation of unconfirmed reports or things that simply aren't true, and the ways that we've seen that impact the American public. Professor El-Jabaghi, I'd like to ask, do you think that there will be calls to close down more schools, to close down more public gatherings? Italy has announced essentially a moratorium on all public weddings and funerals. Do you think that that may be the next step?
Yes. Lots of emergency services and schools and public gatherings are preparing, which I think is a reasonable course of action. I think preparedness does not mean that you're panicking. It just means that you're going to be prepared in the event that something occurs. And I just even received a letter from my kids go to primary school. They're in kindergarten, 4th and 5th grade, and they got a letter from their school just letting us know that there are 0 cases right now, but in the event that there are, that there will be plans to try to transition to online services, just like Georgia College is also preparing to do in the event that there's a widespread outbreak on campus.
Thank you. Quentin, I'd like to ask, a concern among many is the cost of the American medical system and the fact that for many, they can't afford to miss work in order to stay home sick, and many people without health care cannot afford to be tested, they can't afford to go to hospitals, they can't afford to receive care. Do you think that that is going to be a hot button issue in this political cycle, more so than ever, that people are seeing just how necessary healthcare, and in many cases health insurance, is?
Thank you for the question, Ms. Kat. And it gives me, I guess, a slight pause because during my lifetime, and probably not during my panelists, have we lived what we possibly could be facing here in this country or with this world pandemic that could be coming. And I think all the health professionals already characterize it as a pandemic. The sad part is the leadership that we have gotten from this over these past few months has been atrocious, and we could kind of ballerina dance around it, but it's been atrocious. Some things shouldn't be politicalized. Some things shouldn't be a Republican or a Democratic thing. Some things should just be common sense. We had a possible outbreak of Ebola a couple of years ago. It wasn't that long ago, and it was killing people, and the president at the time, President Obama, led with excellence, not because he was a Democrat. He just led with excellence because it was. He stepped out the way and let the experts, let the people with knowledge lead the fight against it to protect the citizens of America. He didn't stand up and say, well, miraculously, it's going to disappear. It's not that bad. The leading news, world news today was concentrating on Florida and how the citizens there, of course, you have a much older population and such, how they're more susceptible. But since their president says it's fine, they're doing public dances, they're doing everything publicly they can do because they say it's not that big of a deal. But as of last night, it was over 200 cases. One of the medical professionals called me already in Florida. That has increased in less than 24 hours. So the impact that will have, unfortunately, unless could be more grave than we can ever imagine. It bothers me. I wish we could have gotten in front of it because we had such a heads up from these other countries. We didn't. It kind of underlines the amount of scrutiny we need to apply when we're electing people to office, because if not, we get leadership like this.
And Jahan, I'd like to ask you, as a professor of business and law, we've seen the stock market take a hit as a result of this global pandemic. What do you think that could spell out in the long term? Do you think that with an increase and with the growth of infected people and the spread of coronavirus, do you think the stock market is going to go even further down? Of course, there's no predicting it.
Well, I'm going to say yes on this one as well.
Okay.
So I'll tell you when I completely think there's no answer from my position. But in this case, I think due to concerns and uncertainty, that it's natural for people to be concerned and to have some unusual reactions in the marketplace. Now, this isn't a reaction, this isn't like a bubble bursting, this isn't any kind of long term, but this is a reaction that is likely to continue to have impacts on the market.
Thank you. And I'd like to speak, Dr. Mock, do you think that this could impact the election? Do you think there could be significant calls for campaigns to cease, for campaign rallies and campaign events to be canceled for fear of the spread?
Sure. I think there may be two levels of answer to that question. The first is that campaigning, as we know, is more than a full-time job. Candidates start their days earlier than most of us, and they end their days later than most of us, and they lead exhausting schedules. That, of course, for anybody is difficult to sustain, and particularly, you know, what it would require of a candidate if crowds aren't turning out in record numbers, if you know, campaign events are maybe not as full as they would be, I think would require any political campaign to maybe pare back some of what they've done in terms of mobilizing a ground operation. I think the second layer of answer maybe deals with what the voting public would expect to see in their political candidates. So they would probably expect more discussion of healthcare, which is something that hasn't maybe gotten the consistent attention so far in the primary season that I would have expected. It's maybe gotten spotty attention. So I think they would expect consistent treatment of healthcare. I think also we would probably be looking for something in our political leaders that is calming and informed and resolute. And that maybe is a little bit different than what we've seen, at least so far in the primary season, where we have, where in the early stages we've been looking for candidates who perform well on the debate stage, candidates who, are maybe compelling retail politicians. Mm-hmm.
If I could add one thing, and I agree with the doctor completely, but when you started off with the congressman who went to the CPAC convention, speaking directly to your question, they was asked to not have that convention because of the possibility of the spread of the coronavirus. But since they live in this bubble of fake news, they went, and now you had more of a hopefully not tragedy, but more possible, but actually more spreading of it did continue. But they was asked not to do it. Now, I think the bigger question is when would people start listening to it and take the politics out of it?
I also think it's interesting that, as we know, coronavirus is more dangerous to people who are immunocompromised, to people who are elderly, and with the exception of Tulsi Gabbard, everyone running for president right now is in their 70s, I believe, at least.
Almost 80.
Almost 80. So it's interesting.
Trump is 73. The two, Sanders and Biden, are both 78 or so.
So I think that is also something to keep in mind. And like Dr. Mock said, these candidates keep exhausting schedules, which is not necessarily conducive to staying healthy. So I think that's also likely a concern coming up for these campaigns. Speaking of Sanders and Biden, so today we're having sort of a mini Super Tuesday, they're calling it Big Tuesday, with primaries in Idaho, Michigan, Mississippi, Missouri, North Dakota, and Washington. Now the big one is Michigan. 4 years ago, Bernie won Michigan, which kept hope alive against Hillary, but this time Biden is ahead in the polls. So I think it's worth asking what impact this Big Tuesday could have for the Democratic primary race. And I'd like to direct this one towards Jahan, if you wouldn't mind. Do you think that in order to stay competitive, Sanders is going to have to win big in Michigan? Do you think that, again, you've mentioned that primaries aren't always a great way of predicting how things are going to go. Do you think that this primary is going to be substantive?
I think after Super Tuesday, that when it shook down to the candidates that we have, and then the subsequent endorsements that occurred, now today's event is so much more important to Sanders than it ever would have been. These endorsements have tipped the balance, I think, in favor of Biden at this point.
Yeah, and we're talking about endorsements from Amy Klobuchar, Pete Buttigieg, Kamala Harris, Cory Booker. Elizabeth Warren has yet to endorse either of the candidates, and there is speculation that she might not. So I'd like to just get a quick question in to each of you. If you could tell me what you think is the biggest political story that we need to look out for in the coming week. Just a quick synopsis. Dr. Mock, if you'd like to start.
Well, I think probably where we began with coronavirus, I think is probably going to be the biggest political story, both domestically and internationally. Those of us who are maybe attuned to international affairs have concerns about the implications for global supply chain, have concerns about freedom of movement across borders, capital not being invested as freely. So I think that's something for us to look for internationally. And of course, you've already helped us to walk through the domestic implications of coronavirus.
Thank you, Dr. Mock.
Likewise, I believe the response to coronavirus will be the biggest story.
Thank you, Professor Al-Jabagi.
Well, if you take that off, which is probably is correct, I think the next one would be if Bernie Sanders would like to unify a party which he's not a member of, because people forget Bernie Sanders is not a Democrat, he's an independent, he would drop out. And that would be the next biggest story of him dropping out. And sooner he does that, the quicker we can get to the bigger picture in November, the real Super Tuesday in November. And that's what most of the Democratic Party is counting down on the day he drops out.
Thank you, Mr. Howell. And
Thank you. You're welcome.
In the coming week, we will keep you updated on as the story develops. Please wash your hands for at least 20 seconds with hot water and soap. Sing happy birthday if you need to count down those 20 seconds. Stay healthy, Georgia College. And a special thank you again to our experts for today. Let's throw it back to Frankie and C.